Hi, everyone. Thanks for joining us. I'm Liz Garman, and I'm the Customer Solutions Manager at Pillcheck. And today we'll be having another LinkedIn Live talking about the latest treatments for overactive bladder and how precision medicine can be used to help guide medication choice for that. And helping us explore this topic today is Dora Chan. She's a pharmacist and functional medicine nutritionist from Toronto, Canada. Dora has a virtual private practice where she helps people to minimize their medications and just optimize their health in general through nutrition and lifestyle. She's also a pharmacist who consults with Pillcheck. And Ruslan is a geneticist with extensive experience in pharmacogenetics, pain, as well as rare disease genetics. And he's also the chief science officer at Pillcheck. So welcome, everyone. With that, let's go ahead and get started. So Dora, maybe you can kick us off here. Can you tell us a bit about what overactive bladder is and how does it develop?
Sure. So overactive bladder is a syndrome. So usually the symptoms are urinary urge or frequency. So you feel like you really have to go pee all the time, even though you might not actually need to pee. And it happens frequently through the day and even through the night. So I have a lot of patients or clients who will wake up multiple times at night to have to go pee. And then throughout the day, they're going to the bathroom all the time, always have to be close to some kind of washroom. And for some people, it can be especially a problem if there's leakage and they need to have special products to protect against that. So it can be a really big problem. And I would say primarily it affects women, but it can affect men as well. Because it does happen largely because of trauma or some kind of damage to the detrusor muscle, which is the muscle that surrounds the bladder. So it can happen with age. So hormonal changes can impact that. Some people just have like an inability to empty the bladder, whether it could be from like neurological damage. So your nerves aren't communicating with the bladder properly, so you can't empty it. Some people even just like if they're not able to get to the washroom fast enough, that can eventually lead to things like overactive bladder and incontinence. And blockages. So in the worst case scenario, if you have some kind of tumor that could block the passage of the urine, it can cause these symptoms as well. And in men, one of the largest causes is an enlarged prostate. So yeah, can be a big problem and really affect people's social lives, right?
Yeah, especially if you're constantly worried about it, thinking about it,
Yeah.
hoping to get to a bathroom in time. How is
Mhm.
overactive bladder treated?
So certainly, as with anything, there's lifestyle and medication options as well. So first of all, lifestyle, even something as simple as avoiding coffee or alcohol, or even for some people, certain spicy foods can irritate the bladder and cause more urination. So that can help. If you smoke, to stop smoking. If you are overweight, to lose some weight. There are some pelvic floor muscles that people can do. So if you have this issue, you should really seek out a pelvic floor therapist or specialist. So there are special exercises. So you probably have heard of the Kegel exercises to strengthen your pelvic floor muscle. There's something called bladder training. So it's actually where you go to the washroom, urinate on a schedule and sort of train your body at set times and set a diary, and that can be helpful for some people. There's something called biofeedback as well, which is kind of cool. And you set up, I think there's electrodes or even use a pad on the skin over the bladder, and you can actually visualize like how your bladder is contracting and learn how to control the urge and control those contractions.
Hmm.
And then in terms of medications, we have lots of options. So for women, sometimes, especially postmenopausal women, of course, topical estrogen therapy can help with the symptoms. Um, there's like Botox injections you can do into the bladder, but there's also lots of oral medications. And our oral medications work primarily by relaxing the bladder muscle. So when the bladder muscle is contracting, that's when you're feeling that urge and that frequency. So these medications help to relax it. And there's two main classes. So The one I usually like to start with is the beta-3 adrenergic agonist, and there's two. One's called mirabegron. The brand name is Myrbetriq, and I don't think it's in Canada, but in the US there's something called Gemtesa or Vibegron. And I prefer these ones only because there's less side effects, even though there is, as with any medication, there is side effects. So I think the most common side effect with Myrbetriq is hypertension and palpitations. And the second class is, they're called antimuscarinics, and there's a whole bunch in that class. Fesoterodine or Toviaz is one, Tilterodine or Detrol, Trospium. I think the oldest one is called oxybutynin or Ditropan. And this last one is interesting because it's been around a while. There's oral ones, there's patches, there's gels, all different forms. And I typically prefer the second line because the side effects are more significant with these ones. The newer agents in this class are a little bit better, but they tend to cause something called anticholinergic side effects. So I likened this to like dries everything out. So people can complain of dry mouth, dry eyes, blurry vision, constipation, although some people will get diarrhea as well. So the side effects can be bothersome with these ones. And then, of course, for men, additionally, there's things to help shrink the prostate. So hormonal therapies or therapies for reducing the size of the prostate would be options in males. Yeah, so a lot of
Reduce the
options.
pressure. Yeah.
Exactly.
And Ruslan, can you tell us how pharmacogenetics is relevant for this? You know, what is some of the precision medicine information that's helpful for managing overactive bladder medications?
Right, so a lot of different medications have DNA-related drug labeling information, right? That warns that some medications might be not effective or causing side effects depending on person's genetics. And there are several drugs that we're actually reporting on Pillcheck that fall into this category, and some of them are metabolized by CYP2D6 gene, and this is very polymorphic gene. So some people have, for example, duplication of this gene, and people with this type of phenotype that will be called ultra-rapid metabolizers, and they will be clear these medications very quickly, making the drug is not effective, right? So people can try this medication and say it's not working, but in reality, it's only because it's being eliminated out of blood circulation very, very quickly. And there are also people that are called poor metabolizers, right? So these people have either deletion of the gene or other variants that reduce metabolic activity. So with the time, the drug concentration build up, and the side effects like dry mouth, making it more and more severe over the time. So in order to prescribe these medications better, instead of guessing and trying different medications, one can do a test like a Pillcheck pharmacogenetic test that will help to assess how different drugs are metabolized. And of course, working with healthcare professionals like Dora to find how to combine these medications. Because unfortunately, a lot of people that suffer from overactive bladder, they're also very likely to be on other medications, like with men would be prostate medications. For women, it could be antidepressants and other things that help to manage anxiety and discomfort. So it's really critical to optimize the therapy based on person's DNA, life stage, and circumstances they need to take this treatment.
Thank you. And Dora, what role can pharmacists play to help improve management of overactive bladder?
So Ruslan already alluded to most of it. I think a pharmacist is really important because we look at the patient as a whole picture. So personally, I also include all the nutrition and lifestyle and all those things. But a pharmacist specifically, we would look at all the medications and those anticholinergic side effects that I mentioned. So the whole drying out of things, and also dementia is one really important one, especially in older adults. Other medications can also have anticholinergic side effects that can be additive to the medications for overactive bladder and make things worse. Plus interactions with how they metabolize, etc. So when a pharmacist takes this holistic picture, then we have a better sense of what side effects the patient might experience and how we can minimize it. And using the genetic data, we can help to choose the medications that would be less likely to cause side effects while still being effective.
Great, thank you. Ruslan, did you have anything you wanted to add?
Yes, so I just want to add that again, pharmacogenetic testing is broader, and unfortunately, as people age, they are more likely to use more and more medications with time. So you need to do pharmacogenetic test only once in a lifetime, and then use it as a guide to prescribe other therapies. So Pillcheck customers always can do it by themselves, looking up the medication profile and see if the drugs are labeled in red, yellow, green. But of course, it would be best to consult with healthcare professionals because we cannot change our own medications on a whim. It has to be prescribed by a doctor and supervised by healthcare professionals like pharmacists. That's why Pillcheck service combines both entities, both DNA test and the pharmacist review.
All right. Well, thanks. I think we're about at the end of our time. So thank you everyone for joining us. And if you'd like to learn more, as always, you can visit our website at pillcheck.ca and check out our education section. There are lots of educational blogs there. And Pillcheck, as Ruslan mentioned, is a pharmacogenetic testing service that includes a genetic test along with a medication review by an expert pharmacist like Dora. And the results can really help you reduce the risk of side effects from medications as well as improve overall treatment efficacy. And if you'd like to hear more or find out more about Dora's functional medicine, nutrition, and medication management practice, you can learn more at drdora.com. So if you have any questions or want to reach out to us, you can contact us at info@pillcheck.ca. Thanks again and have a great day.